It's well known that vaccination is one of the most important achievements in medicine aimed at improving people's quality of life. Recent studies show that there are two vaccines which would prevent significant loss of infant lives: the anti-HPV vaccine and the anti-pneumococcal vaccine. Vaccination against HPV has been promoted as the only safe method to prevent cervical cancer, Romania being the only country in the EU where the anti-HPV compulsory vaccination program has been dropped back in 2009. The result was that people felt extremely suspicious about the vaccine, and while in Great Britain and Portugal the anti-HPV vaccination rates are higher than 80% of the targeted population, in Romania the rates are below 3%. As a result, today Romania is on the first place in the European Union regarding the cervical cancer mortality. Vaccination against pneumococcal diseases refer to pneumonia, meningitis, medium acute otitis and sepsis. The World Health Organization says that the pneumococcal disease is the world's #1 vaccine-preventable cause of death among infants and children younger than 5 years of age. Pneumonia alone kills an estimated 1.4 million children under the age of 5 years every year, more than AIDS, malaria and tuberculosis combined. In Romania, child vaccination awareness among parents is rather low, about 40%, and it's even less when we speak about optional vaccines. In a country with such a low vaccination culture, the 2012 European Immunization Week was not celebrated except for our campaign. The main objective of the campaign was bringing the two vaccines forward on the public agenda. Also, a major goal of the campaign was creating a positive context among the main stakeholders, NGOs, patients' associations, children protection associations, etc. With the main messages of the campaign pointing out, a huge amount of lives can be saved by vaccination if implemented properly. The campaign was designed to talk to each of its main stakeholders and targets. We organized a round table for the authorities with the help of the American Embassy in Bucharest. We talked to the press during a press conference which was backed by the Renașterea Foundation. We organized a flash mob at the busiest subway station in Bucharest, where 70 people from the National Opera Choir, together with two lead opera singers famous in Bucharest, suddenly started singing a famous Napolitano song, Funiculi Funicula. We visited a high school in Bucharest together with the wife of the American ambassador, a former nurse, and the official doctor of the American embassy, and talked to the kids about the dangers of HPV infection once they begin their sex life. The most important objective of the campaign was achieved when a state subsecretary decided to adopt our cause and promote our messages inside the Ministry of Health.
Campania de informare pe care ne propunem să o reluăm și sunt convins că de această dată, pentru că lucrurile o să fie făcute temeinic și într-un timp rezonabil, o să avem și succes.
The results of our campaign on the authorities level are still developing, and as we speak, a national compensation program for immunizing the population is into discussion with the Romanian government. From a media coverage point of view, the PR component reached over 14 million people with the main messages of the campaign. Only the articles in the printed media have been read by an estimated 3 million people, while the information promoted by news portals and websites have reached nearly 10 million unique visitors. TV remains the main channel of information for most of the Romanian population, and this is where we got almost 1 million viewers. Summed up, the campaign got almost 75% of Romania's population and generated €200,000 worth of free media.